Contact tracing is not simply a way to document the spread of a disease through a community. It's a critical public health function which prevents the spread of a disease and saves lives. This video provides a basic overview of how contact tracing prevents the spread of infection. Let's take a typical community comprised of residents from a wide range of backgrounds. Some of these residents work together in factories, others in small or large businesses. Some of these residents attend religious services together, and many frequent restaurants or bars. These residents have different means to get to work, school, or wherever else they desire to go. In some cases, this is mass transit like buses or trains. And of course, there are places where people live, some by themselves and many with others. Most of our lives are filled with interactions with others, and these interactions take different forms with different people. Here's a basic depiction of how people interact with one another. In some cases, these people have close proximity because they live, work, pray, or play together. In other situations, they have intermittent close contact because they're shopping in the same area, getting their hair cut, or eating at a restaurant with others present. Unfortunately, this very normal behavior can create serious problems when we are experiencing a pandemic. Here we have one person, let's call her Joanne. Joanne is infected with the coronavirus, which causes COVID-19, but has not yet developed symptoms. She's in the period of time called asymptomatic, usually 2 to 3 days, in which she's highly contagious but has not yet developed symptoms. Through her normal interactions, Joanne encounters multiple people for 3 more days before she realizes she is sick. Unfortunately, during this time, 3 of those interactions were close enough and for long enough durations that the infection spread. These 3 individuals are now infected and in several days will be contagious. They will also be able to spread the infection without even knowing it. This same pattern of events takes place with each new interaction. Depending on the proximity and duration, each person they come into contact with has different levels of risk. Many will not be infected, but some of them will. These individuals will spread it to others, who will spread it to others, who will spread it to others. Sadly, some who get infected will get sick enough to die. This is more likely among those who are elderly, with existing health problems, and those without access to health care. However, deaths occur across the age span and even among otherwise healthy individuals, so no one is immune from this disease. Here we see Joanne unfortunately did not survive her battle with COVID. Without contact tracing, this spread will continue, and additional people will unfortunately die. This pattern will continue until it is spread throughout the entire community unless we take action to slow that spread. This is where contact tracing comes in. This method has been used to save countless lives for well over 100 years. It is a fairly simple process that just requires effort and cooperation. Here's Frank. Frank's infected with the coronavirus. He's showing signs of COVID-19, such as fever, cough, shortness of breath, muscle aches, or extreme tiredness. Because of those symptoms, Frank decides he's going to call his medical provider to get help. For some who have severe symptoms, they may go to the emergency room. Others who are symptomatic may choose to stay at home to recover from their illness there. In Frank's case, his medical provider performs a nasal swab as part of a PCR test, which detects an actual presence of the virus. This is sent to a lab for analysis. The lab results are sent back to the medical provider and to the local health department as part of a mandated reporting process. Because Frank was positive for COVID-19, he's considered a confirmed case. This is where contact tracing begins. An infectious disease epidemiologist, a trained health department staff person, or a trained contact tracer will contact Frank, the confirmed case, by telephone. The contact tracer will ask questions about his symptoms, about his health problems or concerns, his place of employment during the infection, recent travel, and people that he's had contact with, from a couple of days before his symptoms began until present. The contact tracer will also spend time providing guidance about how to self-isolate to prevent others from getting infected and instructions for when it is safe to leave self-isolation. During the call with Frank, the contact tracer was able to identify 4 people with whom Frank had close contact. Harry, a friend from school, Margaret, his grandmother, James, a coworker, and Elizabeth, his boss. After the initial call with Frank, the contact tracer will call each of these individuals separately to inform them of their exposure to someone who has tested positive for COVID-19, and then go through a series of questions and information regarding the importance to self-quarantine. When the call was made to Harry, the friend from school, the contact tracer learned that Harry had also developed symptoms including fever, shortness of breath, and body aches. Because of his close contacts with Frank, and because he's having these symptoms within the time frame of Frank's infectious period, the contact tracer determines that Harry meets the case definition for a probable case and proceeds to modify the phone call to ask additional questions similar to the call made with Frank. As with Frank, Harry is recommended to self-isolate to prevent the spread of COVID-19. During the call with Harry, the contact tracer explored those people with whom Harry had close contact. 3 people were identified, and all 3 were informed of the exposure, recommended to self-quarantine and to monitor their symptoms for 14 days, and asked to call the health department if anything changes. In addition to the calls for Harry, the contact tracer also called Margaret, the grandmother. The contact tracer learns that she's doing just fine and recommends self-quarantine for 14 days. The contact tracer attempted to call James, the co-worker, but in this case was unable to reach him. He continues to try for several days, but is unable to make contact. Unfortunately, there are some people who are unable to be reached during this process, and we can only hope that they're not infected and spreading it to others. Finally, the contact tracer's call with Elizabeth, Frank's boss, helped to identify more details about Frank's interactions with others at his work. Through this conversation, the contact tracer learned that there were likely a large number of other people that were exposed because of the nature of Frank's job. Because this could be a potential worksite outbreak, the contact tracer involves supervisors at the local health department to learn as much as possible in order to take action to prevent further spread of the virus. How this is done will vary depending on the particulars of the situation. In any case, Elizabeth will be asked to self-quarantine and monitor her symptoms for 14 days. For all cases in which contact is made, periodic follow-up may occur during that 14-day self-quarantine to encourage continued observation of the quarantine and to assess changes in symptoms and to answer any questions. Let's see how contact tracing plays out in our community scenario regarding the spread of infection. As we had previously, there are regular connections among many community members. We also have the first case in any given community, who will likely spread it to others before even knowing they have become infected. The spread will continue until testing is done, contact tracing is conducted, and quarantines are recommended and followed. Unfortunately, some people will not comply with a quarantine request, which will help continue the spread of the infection through the community. Our community choosing to follow recommended quarantines after exposure can significantly reduce the spread of the infection. It will not stop all cases, it will not prevent all deaths, but compared to the alternative, this method is very important in helping to protect our community members. Preventing infection and saving lives takes contact tracing and, most importantly, our community complying with quarantine requests for the full duration after exposure.